Hi, I am Dr. S. Honnani, surgical gastroenterologist. Today I am going to speak about pilonidal sinus. What is pilonidal sinus? Pilonidal sinus is, pilo means hair, noidal means there is a cavity which is draining pus. So the name itself says that it is a hair filled cavity with pus which is draining. Usually it happens in the butt crack. It is also called as jeepers bottom because in World War time, people who used to sit for a long time drive in the jeep, in that time they used to have, so it has a name as jeepers bottom. So what will happen is, it will happen in a people who are more hairy and who have a deep butt crack and big buttocks. So when they walk or when they move, we usually lose every day around 150 to 200 hairs. So that will get stagnated at the butt crack. When the patient walk for a long time, that movement of the buttocks will cause a negative suction. This will suck out the air, and cut end of the air will pierce into the skin pits and it forms a cavity. Over a time this will become big, and when it gets infected it starts discharging foul smelling pus. So patient with this present with pain in the butt crack and pus discharge and very foul smelling sometimes, and this is a continuous process. They will have recurrently once in 2 months, once in 3 months, regularly they are having these problems. When this happens multiple times, they sometimes have multiple pus discharging sinuses all around. It's look like some termite has eaten that part of the body. So now how do you evaluate it? Most of the time clinical examination is enough. So what we do is, whenever patient comes to us, we make them to undress complete lower pant, and we spread the butt cheeks on either side, and I put a very bright light and see whether how many pits are there, whether hair pits are there. Whenever patient has got this kind of problem, it's better they come with a very loose dress, or it should be able to remove the lower garment completely. Once we examine this, second thing is, sometimes very rarely perianal fistula or fistula can also track into the butt crack and present as a pilonidal sinus. It has happened to us once. So whenever we suspect such kind of stuff, what we do is we do get a MRI pelvis. MRI pelvis is say where is the collection, whether it is communicating with the rectum or not, it will tell. So now once this is done, anyway you know now how pilonidal sinus happens, what are the clinical features. Now the treatment. So what is the treatment? See, when we see the literature, there are around 30 to 35 varieties of treatment is there for pilonidal sinus. Whenever there are so many varieties or so many options are there, with that itself will says that none of the treatment is perfect for this disease. The problem with the pilonidal sinus is the treatment success rate in most of the surgeries or most of the procedures are usually 60 to 70%. Some procedures are there, they are very radical, and those have around 80 to 90% of success rate. So whenever we patient comes to us, we stratify them like what kind of disease they have, we grade them. So first thing is whether they are hairy patient or not. First we see that. Second thing is whether their buttocks are very big, whether butt crack is very deep, that is also important. And we see whether the fistula tract are linear with all the pits are in the same line, or there are multiple holes all around the perineal area. My preferred method is to go least invasive, minimal access first. If it fails, then go for a more radical surgeries. So my first preference is, usually I do a minimal access laparoscopic clearing of the tract and remove the hair, and we obliterate the tract with the cautery. Otherwise we do is a laser surgery. Laser surgery is become more advantageous in this case, that we can de-roof, means we can clear the tract completely, then we remove the hair, and with a laser, radial laser we use. Both these laparoscopic or laser surgery is a daycare procedure where patient comes to us and we clear that thing, we observe for 2-3 hours, then we send them. But the daycare procedures cannot be done, or any other procedures cannot be done if patient is very much actively infected, lot of pus is coming. In that case what we do is we drain the pus with a small incision, clear it, then under local anesthesia, and we start the antibiotic, ask them to come over 1 or 2 weeks. Once the infection is settled, then we do the definitive surgery. The drawback with the laser or laparoscopic surgeries, if the tracts are very haphazard, multiple lateral pits are there, in that case what will happen is laser fibers cannot rotate inside and go in that area, so we cannot offer good cure in the laser surgery, chances of recurrence are high. Whenever these kind of conditions are there, or we have done a laser surgery or a laparoscopic surgery, it has failed, then what we do is we do something called flap. the flaps are very much, there are a lot of varieties of flaps are there. We have rotation flap, we have rhomboid flap, we have multiple Z plasties, and we have Bascom flap. So all these, what kind of the flap is decided on what is the amount of area is involved, how much skin is diseased, how much thing we need to remove. Based on that we decide the flap. So once surgery is done, flap is done. Usually flap is a major surgery. Patient has to tend to stay in hospital at least 6 to 7 days. Sometimes we do discharge on 2 to 3 days. What I observed is when we discharge them in 2 to 3 days, they don't take care of the flap in that area. The very fact that patient cannot see that area and they are hesitant to show to others, maybe that is a reason they are not taking proper care. Whenever your flap is there, we are keeping them in the hospital at least for 6 to 7 days, even though they require only tablets. After the surgery or before the surgery, the patient with a pilonidal sinus should take care of one thing, that is removal of the hair. The main causative is back hairs. So when a patient is very hairy, or if they are not hairy, ideally what we say them is remove the back hair. Usually we advise them to undergo waxing on the back and waxing of the buttock area. If they are uncomfortable to get waxing, we suggest to take them to hair removal cream. When they apply, wait for 5 to 6 minutes. After that, if they take hot shower, most of these hairs will go. So we ask them to do this process once in every 15 to 20 days, so that for at least 6 months to 1 year after the surgery, so that won't be hair fall, so that whatever the pit, everything once heals, there won't be any chance of recurrence. Whenever you are using hair cream, what we say is axillary area is somewhat limited to the perineal area. So what you can try is, we can area small amount of area have to apply over the axilla, see whether it causes irritation or burning sensation. In that case, don't go for hair removal cream. Instead of that, go for waxing. If there is no irritation after testing the hair removal cream, then you can go for hair removal cream. Hair removal cream is much easier, comfortable than going for the waxing. Pilonidal sinus, before coming to a consultant or a surgeon, you should have one practical expectation that nobody can cure it for 100%. Because of that, we have so many varieties of treatment. Patient with a pilonidal sinus should have some patience. It is not a life-threatening disease, but it takes a long time to heal. And most important thing in this case is maintaining personal hygiene, keeping the butt crack dry. So if you want similar kind of videos about health issues, please like, subscribe and share my channel.